haven't done anything to that back part of my tooth, so I lost a lot of bone. I want an implant. What can I do? If that's the case, you're gonna have to do some sort of bone grafting. Now, the best bone you can get is your own, and then your body's not gonna reject your own bone. What he's talking about is adding your own bone to cadaver bone. Now, cadaver means that you're getting it from a dead person. Like, let's be real. The question for you is, are you okay with that? I'm totally fine. Some people are like, well, you know what? I ain't doing a dead person on me. Right? Well, then take it out of your own jaw and put it on the other parts, because that's your own bone that's going to be able to be put right on top of where you're missing. So now, in this case, your question is that okay? That's okay. That's going to work. It's not so much as it's going to work now, it's where they can put it, because when you put bone on top of bone like this, yeah, okay, it might work. Now, the question you should have for me is, how good is that? How big is that?